Hello again. In the last two seminars, we spoke about the need for evidence-based practice, levels of evidence, and how to use evidence through guidelines. We talked about good quality studies and how to identify them. To elucidate this further is the objective of this session. Before I start, a word of caution. We tend to be swayed by what is called the halo effect. If a person or a particular journal is reputed, then we tend to consider that everything that is reported in it or by this person must be true. This is called the halo effect, and the contradiction is called the horn effect. If you believe that the journal is not very good, then every article that is published in that we consider as not worthwhile. But where an article is published, which journal, which country, or who wrote it should not be an indication of its trustworthiness and relevance. Good researchers can publish bad articles, bad researchers can publish good articles occasionally. So in order to get across this hurdle is the reason to use critical appraisal skills and tools. This will enable you to search the evidence without bias and reach your own judgment irrespective of the author or the journal. Critical appraisal aims to identify methodological flaws in the published research. So, and then once the methodology is found to be sound, it provides consumers the evidence and the opportunity to make informed decisions about the quality of research, evidence, and how they can apply it in practice. However, there is some truth to the halo and horn effect. High quality journals subject their articles to stringent peer review process. This process helps to identify honest and sometimes not so honest flaws. Hence, articles from such journals are naturally of higher validity and higher quality than articles that come from journals that are predatory in nature. However, all articles are written and reviewed by people, and you must remember this. Hence, flaws may occur. These flaws may not be deliberate, and it may not even be because they have not paid attention. It is just cropped up. Hence, you have to use critical appraisal tools. Critical appraisal tools also help you to reach your own decision rather than depending on the conclusion that is put forth by the authors. So, these are called external and internal validity. Internal validity is the quality of the research, the question, the statistical methods used, and so on. And external validity is the applicability outside of the research situation or the applicability of using it in clinical practice. So I want to elucidate these terms with a rather silly, but I believe an apt example. We are all familiar with the story of the thirsty crow, which we have been learning since lower KG, and we teach this to our children. How many of us have critically appraised it? We have been taught to believe the conclusion. Okay, so I am just going to tell you the crow story in this version. There are many versions. One day a thirsty crow flew all over the fields looking for water. For a long time he could not find it. He felt very weak, almost lost all hope. Suddenly he saw a water jug below the tree. He flew straight down to see if there was any water inside. Yes, he could see some water inside the jug. The crow tried to push his head into the jug. Sadly, he found that the neck of the jug was too narrow. Then he tried to push the jug to tilt for the water to flow out, but the jug was too heavy. The crow thought hard for a while. Then looking around it, he saw some pebbles. He suddenly had a good idea. He started picking up the pebbles one by one, dropping each into the jug. As more and more pebbles filled the jug, the water level kept rising. Soon it was high enough for the crow to drink. His plan had worked. If you just read the story as is, it leaves you with the impression if you work hard or persistently, you will succeed, because this is what we have been told is the moral of the thirsty crow story. This impression is vague and it is inconclusive. If you read the story again with the following questions in mind, what will you think about it? Was there a better way for the crow to quench its thirst? In research, consider this as a comparison intervention. How did the crow know that there was water and it was not his imagination? This is a research question. How many pebbles were required to raise the water level? This would be objective measurement. Would the water not have remained out of reach by filling the spaces between the pebbles? Validity of results. On the whole, was it a better idea than the alternative of finding other more accessible sources of water? That is the overall point of the research. Although the story is very silly, the reason in this context, the reason I brought it out was just to elucidate these points. You need to think about comparison intervention, as I talked about in the previous class, the FICO framework. You need to know if the research question is valid. You want to have objective measurement, relevant measurement. You want to know the results are valid, and you want an overall impression of the point of the research. In the above story, there is lack of comparison, there is a lack of intervention, validity of intervention, lack of objectivity of measurement, and there is lack of the validity of the research question. Unfortunately, a lot of research is also this way, like the thirsty crow. Somebody does something and just does what they normally do in clinical practice without thinking deeply about the research process, in which case the results are no better than Panchatantra stories. It is meant to give a model, it is not research evidence, and it is not something that you must put into practice. Therefore, the reason I'm talking about this is when you read research, when you read an article, you must think about a valid way of critical analyzing the article. must not sway. Instead of reading the article, to be swayed by the name of the journal or the author, you must read it critically. So scales or tools of critical appraisal give you focus and it gives you boundaries for reading the article. When you read an article without this organization, very often you tend to believe what the authors have written, like the moral of the story. And we are not looking at morals of the story, we are looking at research evidence. And it will remain just like what you have been taught to read from textbooks. If the textbook says so, it is true. If the Panchatantra says the crow was clever, then we consider the crow as clever and hardworking. Never mind the fact that we know that it is a bird, and so on. So if you read with focus and boundaries, you learn to read critically. Now, how do you do this? To do this, there are several options. Depending on the type of design, you have a variety of methods. These are broadly classified as checklists and tools. What are checklists? Checklists give direction to what must be looked at. Interpretation is left to the reader. Tools, on the other hand, give interpretation guidelines as well. It also gives you what must be looked at and it gives you how to interpret. Normally, interpretation is if more than 80% of the questions have been found positive, then it is a fairly good article. Some of the checklists and tools are very general, they're generic, some are very stringent. So depending on the article you're reading and depending on what kind of evidence you want to elicit out of it, you must choose the appropriate tool. But there are basic premise of all tools and checklists are more or less the same. He talks about a clearly focused question. Is the question clearly focused? Did the study use valid methods to address this question? So if you have a question, there was a question about whether there was water in the picture. What should have been a clearly focused question? You need to first of all identify if there is water in the picture. So one way that you could probably do it is by dropping a pebble into the water and it splashes. Now some versions of the crow story says that the crow did this, but the version that I told you did not talk about it. So did the study use valid methods to address this question? Once you know there is water, then you think of how you can raise the level. Are the results valid and are the valid results important to you, important to the reader? So if you have a clearly focused question and the design and the methodology are relevant to this question, to answer this question, you should get valid results if the measurement is also appropriate. Once you get valid results, you need to know this if these results are important to you. If the results are important to you, are the results applicable to your patient or population? Sometimes the results may be important from an academic point of view, but they may not be immediately applicable to the patient. This does not mean the study is bad, or it does not mean the study is irrelevant. It just means that at this point, this study is merely of academic interest to you. On this patient, it is not applicable. The last question is judgment based. Is it important, applicable to my patient? That is judgment, and that is based on individuals and their circumstances. So like I said in the last classes, evidence-based medicine is best research evidence in conjunction with patient values and available resources. Now, internal validity is the first few questions, and external validity is the last question. Internal validity talks about the quality of the research, external validity about its external applicability. So internal validity, in short, deals with the research question, the design, sampling and size, sampling strategy and size, participants, their criteria, statistical validity and interpretation. And all scales and checklists have one purpose in mind, and that is to decrease bias. So starting with the research question. If the research question is not clearly focused, then it can have different interpretability. So there is a bias there. Then if the design is not appropriate, it's bad research. If there is sampling bias, if they have selected from a particular place, proper probability sampling has not been addressed, then there are other methods by increasing the size, sample size to cover for the design effect and so on. Were these things done? Participant criteria, are they too homogeneous in nature? If they are too homogeneous, then it may decrease the external validity. But it depends, of course, on the question. Some questions require a homogeneous population. And then you want to look at the statistical validity. Are the statistics done properly? Was there any data dredging? Was the statistics appropriately reported? Was the p-value and the confidence intervals appropriate, or was it too wide? And these are the things that you will look at in statistical validity. And then the interpretation. Statistical significance does not necessarily mean that it is clinically significant. So that is the interpretation. Statistics is numbers. It must be interpreted in a clinical context. That is the clinical application or the clinical significance of the study. This is where MCID and those values come into the picture. I cannot repeat more. I cannot emphasize more. The whole point of critical appraisal tools is to reduce bias, statistical bias. So the more attempts in minimizing bias, the higher the internal validity. External validity is how does this apply to my patient. Now, just to come to some examples, there are some common ways of reading. Now, if you were to see this article, you can click on this. If you can see this article, the article came from Lancet. As soon as you hear Lancet, most of us get goosebumps. Wow, it came in Lancet. Lancet is one of the most highly recommended journals in medicine. This article is easily readable and understandable. It's not high research, it's easy. So the common tendency for any reader would be to jump to the interpretation. Interpretation, if depending on how much time you have or how much patience you have, you will either read the interpretation in abstract. This article does not have a conclusion, it has an interpretation. You would read the interpretation in the abstract, or you would read the full interpretation on page 2498. As it is highly reputable journal, it must have gone through peer review, what it reports must be true. That is a halo effect. What might you have missed if you read it like that? The study is on the premise that commonly available obesity management programs offered by commercial weight loss companies have been proved to be effective. This is what it says in page 2494. For you to understand whether it has been proved to be effective, what is the effect size of this effectiveness, etc., you would have to read the cited article, the article that is cited on page 2494. Until you do that, you do not have this background information. So sometimes you read an article, you need to read many more articles that will give reference to easily and to even understand this particular article. To know the exact program, one would have to understand the components of the program as available in UK from where this article was reported and where it is paid for by the NHS. So that is a sort of participant criteria, slightly biased because the weight loss program is paid for by NHS. There might have been more compliance to the program, which is exactly what they wanted. The authors wanted that. They wanted them to go to the program, and since it is paid for by NHS, they believe that most of their patients would have gone. But immediately, it's a red flag for us that we do not have a similar weight loss, commercial weight loss company, and we do not have a weight loss program that is paid for by our government. The study may have a focused question, it may have impressive statistics, but when you consider the last question on applicability to our patients, we reach a brick wall. Weight loss programs are not standardized in India. They are definitely not paid for by the government. So what happens? Is this article useful to us in practice? Questionable. The article came from Lancet. So what might be, if you were not reading it critically, what might you tend to do? We might tend to assume that commercial weight loss companies in the UK and in India are comparable, and hence we could potentially tell our patients to go for a weight loss program for 12 weeks as they did in any weight loss place and assume that it is going to work. Now, we do not know the components. Because to know the components, we would have to read this cited article, and then if it is comparable to what is being offered in our country, perhaps there would be some applicability. But as is, without doing much more research, this article as is of questionable validity to us. This is external validity. Coming to another article. Use of a patient hand hygiene protocol to reduce hospital-acquired infections and improve nurses' hand washing. This came in the cited journal. The last question on applicability and feasibility. This article is practically applicable to us because hospital-acquired infections is a big problem even in India. It is across the world and it is no less in India. And if you had something as simple as use of a patient hand hygiene protocol to reduce this, it is absolutely applicable and feasible because we have nurses who can wash the patient's hands with the same protocol, and if it is going to decrease mortality and decrease the number of days of stay in ICU, it's wonderful. It is absolutely practical. But what happens to the reporting quality? So there's no question about external validity. When you come to internal validity, what has happened here is the results state reductions in 12-month infection rates were reported for both types of infections, but neither reduction was statistically significant. Mean 12-month nurse hand washing compliance also improved, but not significantly. What these people have done is they did a control of, they did 12 months of control. In the sense, they simply checked how many hospital acquired infections and how often nurses wash their hands. Then the next 12 months was the study period. So they used the same ICU as control. So it was like a time series sort of. The design is appropriate. They use the same ICU with more or less the same nurses, with more or less the same type of patients for 12 months as a control, and then the 12 months as a study. And at the end of it, they found there was no statistical significance in anything. This is what the article says, the results. This has been copied from there. Conclusions say a hand hygiene protocol for patients in the ICU was associated with reductions in hospital-acquired infections and improvements in nurses' hand washing compliance. Prevention of such infections requires continuous quality improvement efforts to monitor lasting effectiveness as well as investigational strategies to eliminate these infections. It is completely contradictory to the results. The results say there was no statistical significance. If there was no statistical significance, we cannot say there was a significance. So there was no statistical validity here. The statistics says there was no significant improvement, whereas the conclusions, they are saying that it did. So we do not know what they meant. So results state no statistical significance and conclusions are contrary. That is reporting quality questionable. Questionable this thing. Even though it is definitely applicable to our population, the reporting quality is questionable. So there appears to be reporting bias. Coming to a third article, this is back pain and backpacks in school children. This came in Journal of Pediatric Orthopedics. Highly rated journal again. Here they tried to look at, the study came from Austria, they looked at whether weight of the backpacks in adolescent school children was associated with back pain. So the problem here is they have said that it is associated, and scoliosis, the things that they checked were whether there was scoliosis in the children, weight of the backpacks, and I think the other. But what happens, we know that pain is a biopsychosocial model. Many variables were not addressed. Results may be too simplistic because it says weight should be not monitored, and the study is by and large inconclusive. So what happens here, for us to reach any sort of evidence, you need to read more articles on the same topic in order to derive any kind of evidence. And the article takes scoliosis, pain medicine, children's opinion about backpack, affecting their back pain, etc. But it does not take into account several other factors that are known to be associated with back pain. For instance, physical activity. Now, they might be having pain because of sporting activities. They might be having pain because of a sedentary lifestyle. There could be other things that are affecting. It could be because of menstrual cycle in girls, etc. Now, what they have done is they have taken a large sample. So, I think it was meant to meant to eliminate all these possibilities. But even then, probably because of so many other factors, the study was inconclusive. So, what happens? We do not have any evidence. Now, this is how you would critically appraise articles based on the premises that I talked about. As it's address a focus question, valid methods, results, impart applicable to my patients, etc. So internal and external validity. So when you do this, all of the three articles that I just talked about, all of them seem to have some problems. Now, this does not mean that these articles are bad. All it means is we need more information before we take the information that has been given as evidence. The last two examples are of questionable internal validity and the first one of external validity. This doesn't mean that all articles are bad, all these articles that I've cited are bad. It only means that there are errors. Like every article is going to have. Every article is going to have flaws. Because finally we are doing clinical research. We are not doing research on inanimate objects. We are not doing basic research in a controlled environment. We are doing clinical research on human beings who, by nature of their being human beings, it is difficult to control for everything. So this is why you must critically appraise. And so when you critically appraise several articles, you will say, I found 5 articles on back pain and backpacks. This had this problem, the second one had this problem, third one had this problem, fourth one had this problem. But strengths, all 5 of them had these strengths, and therefore this is probably the final conclusion of all 5 together may be a valid uh, evidence, and this might be something that I can apply in my practice. This is what we would normally. This is what we need to do. What is quality? Quality in research includes 2 complementary aspects: methodological and reporting quality. Methodological quality refers to articulation of the question, the design that is undertaken, sampling strategy size, and appropriate statistics. Reporting quality includes adequate description of the methodology, adequate description of limitations, adequate description of methods undertaken to decrease bias, linear interpretation of results. For example, the study on hand hygiene conclusion seems to overlook results uh, on hand hygiene. The conclusion seems to overlook results. This is an example of reporting bias. And reporting must be clear so that everybody can understand. More importantly, tables and figures must be understandable and clear. You must also, in reporting, you also need to consider ethical considerations, conflict of interest, etc. Conflict of interest, ethical considerations, and who did what, allocation, concealment, how was the allocation done, and other research characteristics and ethical characteristics and patient characteristics, so that you can decide, you can evaluate the quality of the article. To summarize, just because the author says the pro is hardworking does not mean the pro is. You must assess internal and external validity using standard methods to guide your appraisal. There are a large number of tools. Which one to choose is your choice. Every type of study has specific appraisal tools based on the design. Now we will be going over some of these in the coming classes, but there are extensive resources available. These are some of them, and each of these sites will give you different tools for different types of research design, and using these will allow you to read articles in a more critical fashion and be able to extract the information that you actually want from these articles instead of getting lost in the words. Thank you.